the most common types of things we see in truck drivers are conditions that are affected by increased weight or body mass index. So if you have increased weight, you tend to be more likely to have conditions like diabetes, low back strain, obstructive sleep apnea, cardiac disease, and there also tends to be public health issues.
Sleep apnea is a condition where patients stop breathing or decrease their breathing momentarily during sleep. So what happens is during sleep the airway collapses. It can be completely or partially. So as a consequence, there is not enough space to breathe. So the patient stops breathing for a few seconds until the brain realizes they are not breathing well. So they send a signal to the brain where the patient wakes up and starts breathing again.
So when we think about sleep apnea, the three most common risk factors are obesity, male gender, and middle-aged.
The prevalence of sleep apnea is in the driving population, in the commercial driving population, is higher than the general population. And part of that is due to the exposure that they're getting to being sedentary.
If we don't diagnose it and we don't treat it, that down the road, these people are at higher risk for some really serious health problems. They can get drowsy during the day and end up having vehicular accidents or other accidents or injuries at work. They can make mistakes.
So the diagnosis of sleep apnea is with a sleep study, which means that they have to spend a night sleeping either in the sleep center or with a portable equipment at home. So we monitor their breathing with oxygen levels during the night, and then we determine how many episodes where these patients stop breathing completely or decrease their breathing enough to decrease the oxygen levels. So we have a number of these episodes during the night divided by the number of hours they sleep. So this gives us an index, and that index is if it's above 5 events per hour, it's considered abnormal. So then we classify patients depending on this index in mild, moderate, or severe.